Are you experiencing hip pain when you wake up stiff after sitting, or getting a pinch when you run or squat? Let's talk about why your hips hurt and what you can do about it. I'm Dr. Chris, orthopedic surgeon and co-owner of Human 2.0, and today I'm gonna walk you through some of the most common causes of hip pain and 5 exercises you can start right away to help you move better and feel better. There are a few common reasons people get hip pain. The first is weak glutes. This is one of the most common reasons for hip pain that I see in my patients. Your glutes help to keep your pelvis stable and level. And when they're not doing their job, the front and the side of your hips start taking on too much load. That's where irritation and overuse pain start to show up. The second problem is tight hip flexors. If you sit a lot during the day, that psoas muscle shortens and becomes overactive. That leads to pain in the front of the hip and even some low back discomfort because it pulls the pelvis forward. Third, you may simply have poor hip joint mobility. When the capsule around the hip gets stiff and rotation becomes limited, you end up with that deep, sharp, painful feeling, especially with bending or twisting. Another big cause of hip pain is poor core and pelvic control. If the pelvis is tilting forward, collapsing, or unstable during movement, all that extra motion shows up as stress inside and around the hip joint itself. Repetitive stress from overuse is also extremely common. Increasing your running mileage too quickly, jumping too quickly into high rep squats, or changing activities suddenly can irritate the tissues around the hip faster than they can adapt. And finally, arthritis. Especially if you're over the age of 40, you're an avid runner, or you've had previous hip injuries. Arthritis simply means the cartilage inside the joint is wearing down. It can cause stiffness in the morning, deep groin pain, and reduced rotation of the hips. But it's important to remember, arthritis does not mean you should stop moving. In fact, strength, mobility, and consistency are the best tools that you have to reduce pain and slow down the progression of this disease. So let's get into 5 exercises that hit the big things that matter: strength, mobility, stability, and control. The first exercise is the glute bridge. Lie on your back with your knees bent, push through your feet to lift your hips up into a bridge. Don't arch your back, but squeeze your glutes together. Keep your ribs down and focus on keeping a straight line from your knees through to your shoulders. Do 12 to 15 reps for 2 to 3 sets. You can also do holds with weight, walkouts, and single leg variations. Next is the 90-90 swivel. Sit with both legs out in front at 90 degrees, pointing in the same direction. Slowly lift the outside knee off the floor to swivel to the other side. Try not to move the other leg until you absolutely have to, getting as big a range of motion through the hips as is possible. Swivel slowly back and forth for 3 to 5 reps in each direction. Sit up tall as you move. If this is too difficult, put your hands behind you on the floor for support and lean slightly back. Third is the hip flexor lunge stretch. Get into a half kneeling position. Gently shift forward, and you should feel a stretch at the front of your hip down into your quadricep on the front of your thigh. Tuck your pelvis slightly and keep the glute of the back leg engaged. Hold for 20 to 30 seconds per side for 2 to 3 sets. Fourth is the sideline clamshell. Lie on your side with your knees bent and stacked over top one another. Open your top knee without rolling backward, keeping your feet together. Keep your hips stacked and use a small controlled movement to open your legs and squeeze your glutes together. Do 12 to 20 reps per side. You can add weight and a hold at the top to make it harder. The last exercise is the hip hinge, or a modified deadlift pattern. Stand tall with your feet underneath you, shoulder width apart, with soft knees. Push your hips straight back as if you're closing a car door with your butt. Keep your spine neutral. You should feel the hamstrings tighten and load. Drive through your heels to return to a standing position. Do 10 to 12 reps for 2 sets. Squeeze your glutes together at the top in the upright position. Also, practice hip hinge holds for time and try adding prisoner arms for variety. Adding load to the overhead position with your hands increases the difficulty. If you do these exercises consistently a few times a week, you will feel a difference in how your hips move and feel. Strengthen the glutes, open the hip flexors, improve your rotation, and learn to hinge properly. That's the foundation of long-term hip health. Check out our hip health playlist for more exercises and follow along workouts right here on YouTube. And if you're in Ottawa and need personalized help, come check us out at Human 2.0.